Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we are jumping into a really fascinating medical detective story. It's got all the classic elements, a young patient, some really baffling symptoms, and a huge clue hidden deep inside the brain. So let's get right into the investigation.
So, to get started, I want you to just picture this for a second. You've got this massive superhighway, cars are just flying along, but instead of exit ramps that slow everything down, the highway just dumps traffic directly onto quiet little neighborhood streets. I mean, what would happen? Total chaos, right? Just keep that picture in your head, because it is the absolute key to unlocking this entire mystery. Okay, so our story kicks off with a 14-year-old girl. For several months now, she's been dealing with these really frightening and just debilitating symptoms that have her and her family searching for answers. The medical detectives, well, they've got their first case file.
And here are the first clues. We're not talking about a one-off thing here. These are recurrent seizures, severe headaches, and they're happening over and over again, and in someone so young. So right off the bat, we know something chronic and something serious is going on.
With symptoms like these, there's really only one place you gotta look for answers: the source. The medical team knows they have to get a crystal clear picture of what's happening inside this girl's brain if they're gonna have any hope of solving this case.
And that, of course, leads them to their most powerful investigative tool, the MRI. This is where they find their first huge break in the case, a really strange, really telltale pattern that just immediately catches their eye.
Okay, so what we're looking at here is fascinating. Look at that tangle of vessels. See those dark, winding channels mixed in there? Those are what doctors call flow voids. And the whole thing has this classic, if maybe a little unsettling nickname, a bag of worms. So what in the world are these serpiginous flow voids? Well, serpiginous just means winding, kind of snake-like. But the voids, that's the amazing part. The blood is moving through these channels so incredibly fast that the MRI machine can't even get a signal from it. It's like a motion blur in a photo. The blood becomes a ghost in the machine, leaving behind only these dark, empty spaces.
And this single powerful clue, these high-speed flow voids, it points the entire investigation directly at one prime suspect, a congenital condition called a cerebral arteriovenous malformation, or just AVM for short.
And this brings us right back to our highway analogy. An AVM is exactly that. It's a traffic system with no off-ramps. You've got high-pressure arteries, our superhighways, connecting directly to low-pressure veins, our quiet streets. That tiny, absolutely crucial capillary network that's supposed to slow the blood down and deliver oxygen, it's just completely missing. It's a fundamental flaw in the brain's plumbing. Now, this faulty connection sets off a really dangerous chain reaction. First, you get this high-pressure arterial blood just slamming into the weak-walled veins. Now, the veins, they aren't built for that kind of pressure, so they swell up, they get all twisted. This constant high-pressure chaos irritates the brain tissue around it, which causes the seizures, and it creates this huge risk of a rupture, which would lead to a brain bleed. Suddenly, the symptoms make perfect sense.
And if a pathologist were to actually put this tissue under a microscope, this is exactly what they would see. This isn't just a theory, it's the physical histological proof. It's the smoking gun that confirms the identity of our culprit.
But, a good detective doesn't just identify a suspect. They also have to rule out all the other possibilities. In medicine, we call this a differential diagnosis. So the doctors assemble a lineup of the other usual suspects that can cause this kind of trouble in the brain.
So let's just quickly run through this rogues gallery. Glioblastoma? Nope, typically affects older patients and looks totally different on a scan. CNS lymphoma? Same story. Wrong patient profile, wrong imaging. Multiple sclerosis? Well, that affects the brain's wiring, not its plumbing. And toxoplasmosis? That shows up with a very distinct ring-like pattern. Every single suspect has a perfect alibi.
So after you eliminate all the imposters, the verdict is it's undeniable. The patient's age, her symptoms, and most importantly, that classic bag of worms pattern of high-speed flow voids on the MRI, all the evidence points to one and only one conclusion. All right, so let's boil this entire medical investigation down. How do we take this whole complex case and turn it into a memorable, high-yield takeaway? Well, it's actually surprisingly simple. Here it is. This is the simple equation that just cracks the case. When you see a young person, like a teenager, who's presenting with new seizures and headaches,
and their MRI shows that bag of worms pattern, you can be incredibly confident in the diagnosis of a cerebral AVM. It's just a classic clinical picture.
And just like that, our detective story comes to a close. We started with a total mystery, these frightening seizures in a young girl, and we just followed the clues. From the patient's story all the way to these incredible images from inside her own brain, the evidence guided us straight to the right answer.
You know, for our 14-year-old patient, this diagnosis wasn't just an answer to a puzzle. It was the key to getting her life back. It just goes to show how finding that one right diagnostic clue can unlock not just a medical secret, but a person's entire future. It kind of leaves you with a final thought, doesn't it? How many other conditions are out there, just hiding in plain sight, waiting for the right key to unlock their secrets?